Awesome. Welcome to our next session of the virtual fair. We'll get started in just a moment. Awesome. Well, welcome everyone to day 2 of the virtual fair. Here we are at our next session, the often overlooked careers in pharmacy, opportunities across state and federal agencies. And so, like the title suggests, this session will explore pharmacy career opportunities at the federal level, such as the FDA, NIH, CDC, Armed Forces, and Indian Health Services, as well as some other career opportunities available at the state level. And with that, I will hand it over to our speaker. Oh, and really quickly, if you have any questions during the session, please put them in the chat or the Q&A box, and we'll try to get to them after the presentation. If not, you're always welcome to go to their booth to learn more about this topic. But without further ado, I will hand it over to you, Nate.
Thank you. Yes, thank you everyone for attending. Today, I'm going to present, and hopefully my co-presenter will also join us. And if not, I have her slides so we can actually bring them forward and talk about them. But yes, I'm Nate Rickles, and I'm Associate Dean of Admissions and Student Affairs and Professor of Pharmacy Practice at the University of Connecticut School of Pharmacy in Storrs, Connecticut. And joining us hopefully today will be Tiffany Vicente. Dr. Vicente is a recent UConn School of Pharmacy graduate that is at Indian Health Service right now, where she also had a student experience. But she is now an employed staff pharmacist for them, and I believe she's based in North Dakota. So that is a little bit of our background, and I'll talk a little bit about how I got excited about state and federal opportunities as we go along. Okay, so today we're going to we just had our introductions. We're going to talk about this landscape of state and federal careers and how they're often overlooked. We're going to talk about 8 different examples of state and federal careers, and then wrap up with some conclusion and an opportunity for some questions. So, and then I feel every presentation should have, you know, learning objectives. So we're going to hopefully talk about the nature and scope of pharmacist positions available at different state and federal agencies, distinguish how the different experiences might relate to individual preferences and needs, and identify possible steps to investigate these opportunities as well. So, I'm sorry, I just went a little bit further than I needed to. So let me just back up. Yeah, okay, here. So the pharmacy schools and colleges, we typically focus on traditional areas of practice. And many of you know that conversations around community pharmacy, it's around health system pharmacy, ambulatory care, industry, drug information, and in various acute care settings, so critical care, medicine, and so forth. We tend to, and the reason why those are a focus is because there are a number of faculty representing those different areas or have had experiences in those common areas that are at the schools and colleges of pharmacy. So that it's just a natural alignment between experience and introducing it to the students. There tends to be fewer champions available at the schools and colleges of pharmacy familiar with the state and federal opportunities. And so I think that's where it's really valuable if you don't have those folks at your school to certainly encourage them to visit campus. I'm talking like, the Indian Health Service or, the FDA, and they actually sometimes have people coming to the campuses and actually talking about their sites. So again, and some of this will depend on where you are in the country and the visibility of the pharmacists at the state and federal levels. So the more folks get exposed to state and federal opportunities and actually show up at state and federal professional meetings and become more involved, the more likely the students will get to meet these individuals and hopefully take an interest in, or at least exploring these state and federal opportunities. So it is really about a crossroad, and that's the pictorial there, is to sort of get you to think that, you're kind of making decisions at different points and really looking at state and federal opportunities as an opportunity to see if that's your pathway. So, when I went to pharmacy school, I was exposed to actually the public health service because at the time, the associate dean, and he actually became dean, was really passionate about the Indian Health Service, and he really promoted different opportunities that students could take advantage of. And so I actually followed through on that. And so I will bring that up as we talk about one of the agencies where I actually began my exploration as a pharmacy student. So we'll talk about that. And there's no order to the examples that we will be covering. So I just want you to appreciate that they are just, presented in a way that we're going from state onto federal. And I see Dr. Vicente has joined us, that we will, start, we'll get to Dr. Vicente's piece. But I might actually pause for a moment and actually, Dr. Vicente, did you want to briefly introduce yourself to the audience?
Yeah, sorry for joining a little bit later. I was having some technological difficulties. So my name is Tiffany Vicente. I'm a public health officer at the Indian Health Service. And I'm just happy to be here. I'm currently stationed at the Quentin and Burdick Hospital in North Dakota. I'm originally from Massachusetts, so it was kind of like a long journey for me to going into from just working at like a retail setting to transitioning to working for the government in the hospital setting.
Great, thank you, thank you. So we're going to start talking about state agencies, and there are many pharmacists that are employed at state agencies across the country. They're often connected with a state's Department of Public Health, mental health, social services, drug control actually has quite a few pharmacists. I don't know if all the states call their division of drug control that, but it's something like that. Many times there's pharmacists that are connected to the prescription drug monitoring and reporting programs. So, there's usually some group that's focused on, the utilization of drugs in the state. So whatever that is called in your state, that would be a place where a number of pharmacists are at. So I'm going to give you experiences that I've had with the Department of Public Health. And, that group is really focused on developing, implementing, evaluating prevention programs and initiatives. And I've seen most of the work that they have done is really around vaccinations, at least that pharmacists have been involved. It's been really around vaccinations. However, they also dabble in other areas. For example, I've joined public health in going to a health department in our state in Connecticut and actually talking about the role of pharmacy practice and helping with asthma management. So that was a part of a collaboration with the Department of Public Health. The one that I'm most familiar with is one that I was a principal investigator of for a number of years, probably 5 or 6 years, and it was called Well Integrated Screening and Evaluation for Women Across the Nation, otherwise known as Wise Woman. And this was that they envisioned the role of the pharmacist, a really important role in medication therapy management. And they had a population of women that were currently being under surveillance for prevention in terms of breast and cervical cancer. So they said, well, these women have needs, and then they extended it to cardiovascular health. And that's really where they saw the pharmacist being involved in helping to manage hypertension, diabetes, and things like that for these women who are in this surveillance program. And so a few pharmacists and I actually helped to develop and implement a medication therapy management program with these women who are largely underserved women. They were individuals with diverse backgrounds, and they were typically low income, and we provided that gap in care that they were not typically receiving great medication therapy management previously. So anyway, that was a way that pharmacy was involved with the Department of Public Health. And keep in mind that a lot of departments of public health get funding from the CDC. So the CDC, or the Centers for Disease Control, which is a separate slide, that they actually fund some of the pharmacy projects. And then the Department of Mental Health and Addiction Services, which I am currently, I've actually, the funding with the Wise Women program has ended. Our role with that has ended, but we are still with the Department of Mental Health and Addiction Services, which actually Dr. Vicente was sort of helping out a little bit in some of that work. And that's how we worked closely together with her role in a program we call Adopt a Health District, where she was actually working with a health district and actually providing harm reduction services. So we've had a critical role in opioid reduction, substance misuse, and other aspects of harm reduction related to mental health. So I think there's ways that pharmacists can be involved, and pharmacists have been funded through these different agencies, and some of their work has really improved the healthcare of the state. And I should back up and say that, one thing I didn't mention in how I introduced myself, I'm also a psychiatric pharmacist. So I'm also bringing forward my expertise in substance use and mental health disorders. So that for me, the Department of Mental Health and Addiction Services is very much a good fit. In this slide, we talk about pharmacists that are employed by drug control. And I said it could be, called something different at your state, but it's really helping to manage the prescription drug monitoring, developing regulations, implementing regulations, enforcing the state's regulations. So many of you have heard of inspectors that come to the pharmacy. Well, they're coming out of drug control, and they're just checking to make sure there's compliance with the various pharmacy practice laws. This is also connected to another hat I have actually recently taken on, which is I teach the pharmacy law course at University of Connecticut. So this is very much a part of, and I'm co-teaching with the former head of drug control. So it's actually a nice relationship around, but he's a pharmacist, and he has several pharmacists that were working for him. So again, a great opportunity. Then moving into the State Pharmacy Association, I just really want to let you know, some of you have really wonderful social skills, leadership skills. So if that's your thing, what a great career. And I've worked with pharmacy associations quite a bit. Even as a pharmacy student, I was very much involved with the health system pharmacy group and some of the community pharmacy groups when I went to what's now called the University of the Sciences in Philadelphia, or used to be the Philadelphia College of Pharmacy. But anyway, you can really advocate, be the voice of the profession. I'm still to this day trying to be as active as I can with the American Pharmacists Association and working with them in advocacy. And I was among several pharmacists that go to the legislature and actually provide testimony in support of different legislation and so forth. So again, but the State Pharmacy Association is the one who's really convening it, making it all happen. And anyway, if you really like organizing your colleagues together and promoting their work and advocating for the profession, that is a full-time job. And it really helps when it's a pharmacist that's doing it. So not all pharmacy associations have pharmacist leaders, but it's awfully nice when they do. So I'm going to take a pause and catch my breath, and Dr. Vicente will talk about her Indian Health Service work.
Yeah, so before I get started about what it's like working as a pharmacist for Indian Health Service. I wanted to talk a little bit about when I was a student at going through my APPE rotations for the Indian Health Service. So originally, I did an APPE rotation in management for the Crown Point Service Unit in New Mexico. And this was a great opportunity for me to like get a firsthand experience as what would it be look like if I were to work as a pharmacist in the future. This is prior to before I decided to even apply for the public health service to work as a pharmacist, which would then bring you to different avenues where you can either work in CDC, FDA, ICE, IHS, and Bureau of Prisons, BOP. So as a student, when I was actually an APPE student for the Crown Point Service Unit, Indian Health Service, I had the opportunity to counsel patients on all their medications. I also had the opportunity to sit in the committee panels that the hospital had. One of them was the immunization panel, where anything that was updated for like at the time, like the flu vaccine, COVID vaccines, during that time when they were updated guidelines for them. I had the opportunity to kind of inform the entire hospital, all the staff on these new updated guidelines. So this was a great opportunity as a student to be very much involved with all the staff, the pharmacists, and especially other public health officers if you were planning to join this group. So this was a great way to build connections overall. And that's kind of how I kind of was very much interested in working with public health. One of the things is right now, as I'm working as a pharmacist, we have multiple ambulatory clinics. So our hospital has collaborative practice agreements with our providers. And so we're able to see patients once they're referred from the provider to us for diabetes, asthma, hypertension, smoking cessation. I will say this is very different from like most hospitals and retail settings. You're doing a lot. You're not just verifying medications, which that is one of the things we do, but we're also going out into the community and working with the Indian population. So one of the things I just recently we completed was we were doing HIV testing and syphilis testing in the community. We were reaching out to multiple locations to be able to work with the population and making sure that they receive testing, but then also get treated for them. The other thing that we've also do is we do a lot of data entry from outside providers and in-house providers, because we do have same-day clinics, but then we also work with the emergency room department as well. So we also do some like medication reconciliation from in-house and external providers as well. Other things we also do as pharmacists is that we can lead committee meetings, whether it's controlled substances, microbial stewardship, or the pharmacy and therapeutics committee. And other things is every week, you're always going to be working at a different station. You can also decide to choose whether or not you want to specialize in a specific ambulatory care setting. They really leave it up to what do you really want to get out of it from this experience. And that's one thing I've kind of really liked about this job, because it's very different from most fields I've noticed, and it's allowed me to really grow as a pharmacist. So in terms of like future work, well, yeah, so in terms of future work and like opportunities, I will say this, even though I'm currently working in the outpatient setting, recently, just this week, I started being trained in the ER. So I will say this, I know that some misconception is like, if you work a certain amount of years in a retail setting, you can eventually, once you have transferable skills, you can transfer to the hospital setting, or those that want to do residency, if they plan on working in the hospital setting, then that's kind of usually the go-to. Well, I will say this, I don't have any residency training experience. However, I am interested in working in more inpatient, and I was given the opportunity to do so, to work inpatient and in the ER. So although I don't have any residency experience, this was a great way for me to get into that and be trained in it. So they do have a good support system here if that's something you're interested in, where you don't have the opportunities or the resources available to do residency, but you still want to like work in a hospital setting, then I will usually say either Indian Health Service or BOP can be a great way for you to get into that. And I will also say that I've met many people where they started at Indian Health Service or the BOP, and they eventually, when they feel like they kind of want to challenge themselves or or go into a different role, this will actually help lead you to that, because I've met people that used to work in BOP and now they work for CMS, which is like Medicare services. So for Medicare, if you are interested in the opportunities where you can branch out to different areas, then Indian Health Service or BOP or just in general public health service will help you lead into those different roles. You can also take on different projects, which is like drug utilization projects. You can do that. It's really kind of up to you as to what you want to do. And that's the great thing about Indian Health Service. Um, it's really based off of how much effort you want to put in to your job and what you want to get out of it. If you would like to put in more, you can get more out of it. If you would like to put in less, you'll get less out of it. And that's one thing I've kind of pretty much noticed here starting out here as a new pharmacist.
Thank you, Dr. Vicente. So these next few slides, and I think that's a good overview in mentioning about the BOP, which is the Bureau of Prisons, which we're now going to briefly talk about. And these next slides are going to kind of go more briefly just because some of the skill sets and whatnot are similar across them. I mean, you're going to have a pharmacist that's going to be responsible for dispensing, counseling, pharmaceutical care, advising, being involved in potentially training and fellowship across these different settings. It's really what changes is the population that's being served. So, for example, with the armed forces, and I have all the six or so different, 7 or so different armed forces, where you can see the Army, the Marine Corps, the Air Force, the Navy, and I think I might have had Air Force twice there. And then obviously we talked about the Bureau of Prisons. So these are all different kinds of ways that you can serve as a pharmacist. And there you're serving the community, the armed force members and their families. And so it's just a great way to engage in collaborative practice agreements and being at the top of your practicing at the top of your license, if you will. The FDA, I just want to sort of mention this for a pause. Some of these sort of, I think some of the compounding and whatnot probably happens in a very specialized area of the FDA. The one part of the FDA that I'm more familiar with is really, with post-marketing surveillance and kind of related to drug development. Obviously, the FDA is really focused on drug development, and they spend have quite a few pharmacists involved in the different aspects of drug therapy. In fact, I'm doing an FDA grant right now. I have an FDA grant, and the person who's helping to oversee the management of my grant is a pharmacist. So anyway, they're really involved in different areas of the FDA. In fact, the FDA employs quite a few pharmacists. So just something to now, I just want to share with you, I did what was called a junior COSTEP, or commissioned officer student training externship program. And I think Dr. Vicente, you also did a co-step, right? Or
Yeah,
yeah,
so I'm actually a senior co-step.
senior co-step.
So
Yeah.
yeah, so that was a separate program where in your third year of pharmacy school, your P3 year at the end, if you decide to want to commit to the public health service, um, then you can apply for the senior co-step, and that will directly um, provide you a job during the middle to the end of your P4 year, and you would automatically, upon graduation, you would automatically move to your location site. So during that time, you can receive offers from ICE, BOP, or IHS. I think you can receive offers for FDA or CDC. I'm not exactly sure, but I know for the BOP, ICE, and IHS, you can receive offers for upon graduation. And then you can decide whether or not you would like to receive their offer or decline. And they'll be from different locations, and you'll receive interviews for them. But if you do accept, then you will automatically know that you have a job before the end of your P4 year. Usually before you apply for residency, you would most likely know by then. So around like September, July, I would say.
Great. Yeah, so that's good insight on that. And then just know that, like for example, you can really do some innovative things. I was able to get two manuscripts and I was a PharmD student, and being a part of manuscripts and really helping the FDA advance some policy. Um, so here's a little bit more. I talked about my summer experience, and we talked a little bit about some of that. So another area of the DEA is, rather another agency is the Drug Enforcement Agency, and I've worked with pharmacists that work for them. And if some of you like to be a part of a criminal investigative team and work that angle, there's a number of things you can do where you're a part of the tracking of looking at drug traffickers and trying to you know or any violators, and seeing if you can enforce the law and so forth. So anyway, it's a really great opportunity, and for those of you who lean towards the law and the enforcement piece, what a great opportunity. I mentioned already about the CDC, so we probably don't need to talk too much. There are fellowships that are present at the CDC, so that may be something you want to explore at some point. But a lot of pharmacists that are at the CDC are often research scientists, and they're investigating vaccines and different infectious diseases and so forth. And then there's pharmacists that work at NIH and other federal agencies. And I put, Dr. Vicente mentioned CMS, that's the Center for Medicare and Medicaid Services. PCORI is the Patient-Centered Outcomes Research Institute. One of our faculty actually did an experience there, actually was employed by PCORI for, I think, about 3 years. I have funding that actually, so just like CDC funds the Department of Public Health, SAMHSA also funds the Department of Mental Health Addiction Services. So that Adopt a Health District grant that Tiffany was a part of, though that is actually funded actually from SAMHSA. There's pharmacists that work at the Health Resources and Services Administration, which is really responsible for a lot of professional training in the health professions. So again, you can analyze data sets, you can conduct all kinds of research. Pharmacists involved in helping to award grants and educate program investigators on different opportunities and how to prepare those proposals. So in this last slide, I really wanted to kind of alert you to all the different careers that are out there. It's really exciting. Opportunity to collaborate with a lot of stakeholders. And don't forget, state and federal benefits are not anything to take lightly. They're really very often robust. And I just love being a part of something bigger than just a part of something that serves the state and the country. It's just really empowering. And then here's some of our contact information. And I know we only have like a minute left, and I see a question in the chat.
Yeah, I think we have time for that question if you want to answer it. So it's what qualifications would be needed for some of these agencies like HRSA, SAMHSA, and FDA?
Yeah, so great question. So first of all, they would want, if they're hiring you for your pharmacy expertise, certainly being a registered pharmacist is important. I think it depends, like with NIH, if they have you, so if I have a good friend at NIH, and he's a clinical pharmacy specialist focused in mental health psychiatry, which is my background. So Jerry actually has been at the NIH for, I don't know, 30 years or better. So again, he had to do probably a residency and fellowship to get that kind of expertise. So I think it depends on what you do, but if you're sort of more coming in as a generalist, probably just having your PharmD degree and some passion, you probably could get an entry level position. Yeah, good question.
Awesome. And I think with that, we are right at time. So thank you both for that really great presentation. If any of our attendees have any more questions, definitely head on over to the UConn School of Pharmacy booth or take a screenshot of their contact info. There are about 15 minutes until the next session, so please make sure that you visit our expo and chat with our lovely representatives. Thank you both for this presentation. I'll see everyone else in the next one.
Yep. Thank you, everyone. And thank you, Dr. Vicente.